This is our family. My name is Martin, and I'm an acupuncturist.
My name is Emily, and I'm a chiropractor.
Ori's our son, and Annie's our daughter.
Our lifestyle is definitely unconventional for most people. We don't want to be normal. We're inviting you into our lives to get a glimpse of what we do to stay healthy. So this is a video for women only, so men, you've been warned. Women, have you ever found yourself when you're about to sneeze or cough, you're crossing your legs, or afraid to do exercise because you're afraid that it might leak a little bit? And I know this is embarrassing to talk about, but it's very common. It's not normal, however. What happens is that a lot of times after women have birth, this happens, but sometimes it shows up, even 10 or 20 years down the road. And you can have symptoms that show up like leakage or incontinence, or it can be things like frequent bladder infections. It can be problems with your menstrual cycle. It can be bladder infections that are very frequent. It can be a heaviness feeling. Down the road, it can even lead to a prolapse, which is obviously an even bigger deal. And none of this is normal. Even if you have any tension in that area, it can even, with problems with your cycle, it can even lead to problems with infertility, things like that. And so it's definitely worth getting checked out. Martin had a patient recently who came in, and she had, for 3 years, bladder infections all the time. And she did all the conventional stuff, took antibiotics all the time, and nothing took care of it. And she went to see a pelvic floor physiotherapist, did all the exercises, and she was good. So for me, this started being a little bit of a problem after my second child. But I wasn't sure, because I heard that some people, you just do Kegels and you're okay, but some people can be too tight and some people can be too loose. So I didn't know, what my pelvic floor was like. So I went to see a pelvic floor physiotherapist, and she did an assessment to find out, and I have the proper exercises to work on. And so really there's a solution to all of this. None of the things that I mentioned is normal. Actually, another symptom, it could even be pain during intercourse, which is common but not normal either. So if you get assessed properly, do the right exercises, then you can get rid of all that stuff. And so you'll meet Yolanda, the person that I met with and who helped me along this journey, and she'll talk to you a little bit more. All right, see you next time.
So what pelvic floor physio does, it's a conservative type of treatment that focuses on optimizing your pelvic health and in this region. So basically you're looking at muscles such as the pelvic floor muscles, okay? So the pelvic floor muscles, they're basically muscles at the bottom of the pelvis here. They're like a funnel-shaped muscle that attaches to the front of the pelvis here, called the pubic symphysis, and goes all the way to the back. And they're a really important muscle. Until you have problems, so unfortunately, you don't realize they're there for women. But basically, what it does, that the function is that it houses the pelvic organs. So it prevents things from prolapsing out, which is basically when things hang out of your vagina, which you don't want. So your uterus and your rectum sit here. And when this muscle contracts, it basically closes the opening of the bladder, which is called the urethra, and also helps with closing the opening of the anus, which is called the external sphincters. Okay, so with pelvic floor physio, the conditions that I see the most and I treat that you've probably heard of are incontinence, which is any kind of urinary incontinence, leakage of urine or fecal matter, and prolapse, so the organs coming out, and also pelvic pain is a huge thing, pain during intercourse. So having any bit of incontinence or pain is not normal, so treating for this is important.